When first used in the United States in the 1870s, the term homelessness was meant to describe itinerant tramps traversing the country in search of work. The primary emphasis at this time was on the loss of character and a perceived emerging moral crisis that threatened long-held ideas of home life, rather than on the lack of a permanent home. One religious group described the problem as a quote-unquote crisis of men let loose from all the habits of domestic life, wandering without aim or home. Cited from De Pastino, 2003, page 25. The solution to homelessness today is often perceived to be the creation or availability of affordable housing, but during the early 20th century, jobs rather than housing were viewed as the solution to the plight of transients wandering the country. Fewer than 7% of Americans lived in cities prior to the 1820s. Kim and Margot, 2003. Growing industrialization in the 19th century brought a steady migration to urban centers such as Boston, New York, and Philadelphia, and vagrancy records suggest a rise in the numbers of those in search of work in these cities. The Industrial Revolution ushered in a shift from an individual living and surviving on farms or working in a skilled trades to the wage-earning worker dependent upon wealthy employers. By the 1850s, lodging rooms for vagrants located in police stations served as the major shelter system. And most major cities reported increasing numbers of vagabonds, cited by Kuzmer in 2002. After declining briefly after the Civil War, homelessness first became a national issue in the 1870s. Facilitated by the construction of the national railroad system, urbanization, industrialization, and mobility led to the emergence of tramps, quote-unquote, riding the rails in search of jobs. Jacob Riis, the Danish-born social reformer and muckraker, whose later photojournalism depicted the deplorable lives of those in slums and tenements, arrived in America in 1870 at the age of 21 and described his subsequent 3 years as a member of, quote-unquote, the great army of tramps seeking work across the country. This, quote-unquote, army of overwhelmingly young, able-bodied white men created a culture that blended the search for work with a love of the open road and a disdain for the constraints of workers in industrialized America. Founded by, once again, De Pastino in 2003. Willing to embrace wrath of mainstream society, Francis Wayland, the dean of Yale Law School, wrote in 1877, "As we utter the word tramp, there arises straightway before us the spectacle of a lazy, shiftless, sauntering or swaggering, ill-conditioned, irreclaimable, incorrigible, cowardly, utterly depraved savage." The word hobo first appeared in the 1880s in Western America and softened the public's perceptions of tramps. This culture of migrant laborers were often romanticized in American literature, including by writers such as Walt Whitman, Bret Harte, and Sinclair Lewis. Jack London wrote vivid depictions of the quote-unquote call of the road as an escape from the oppression and monotony of factory work, founded by Etulain in 1979. The storied hobo culture, popularized in the 1920s as hobohemia by Chicago sociologist and former tramp Nels Anderson, faded as companies began to value loyalty and longevity and as seasonal jobs began to be taken by immigrant farm workers. World War II emerged as an economic engine that put the nation to work. Over the ensuing 3 decades, the typical individual experiencing homelessness continued to be disproportionately white and male, but became increasingly older, usually over 50 years old, disabled, dependent on welfare or Social Security, and resided in cheap hotels, flop houses, and in single-room occupancy hotels, also known as SROs, located in the poorest neighborhoods and Skid Row areas of urban period, would be considered quote-unquote housed under HUD's current definition of homelessness. This observation underscores the difficulty in defining and studying homelessness throughout U.S. history. The modern era of homelessness. The early 1980s marked the emergence of what now may be considered the modern era of homelessness. Major forces that changed the complexion of homelessness in the modern era include gentrification of the inner city, deinstitutionalization of the mentally ill, high unemployment rate, the emergence of HIV and AIDS, an inadequate supply of affordable housing options, and deep budget cuts to the U.S. Department of Housing and Urban Development, also known as HUD, and social service agencies in response to what was then the country's worst recession since the Great Depression, cited by Jones in 2015. In some cities, property values increased dramatically in the areas near downtown. In Skid Row, areas disappeared as the SROs and rooming houses that were home to thousands of transients were razed or converted into apartments and condominiums. Since the 1980s, rents in metro areas across the country have been increasing while wages have stagnated. Founded by Katz in 2006. Recent research indicates that families experiencing homelessness are more likely to continue to face poverty and homelessness in the future, cited by Desmond in 2016. Deinstitutionalization of the mentally ill has roots in the civil rights and civil liberties movements of the 1960s, which envisioned more fulfilling lives for those who had been languishing in understaffed psychiatric hospitals through new medications and robust community-based services. The number of patients living in state hospital dropped from 535,000 in 1960 to 137,000 in 1980. California saw a dramatic reduction in state hospital beds from 37,000 in 1955 to 2,500 in 1983 by Flynn in 1985. Funding for the needed housing and community-based services proved inadequate, and as cheap housing disappeared, vast numbers of previously institutionalized individuals with severe and persistent mental illness or those who might have gone to institutions in earlier eras drifted onto the streets and into temporary shelters. The recession of the 1980s resulted in deep cuts to the HUD budget, which decreased from approximately $29 billion in 1976 to approximately $17 billion in 1980, and led directly to reductions in the budget authority for housing assistance from almost $19 billion in 1976 to about $11 billion in 1980, and in subsidized housing for poor Americans, OMB 2001. Two changes in policy particularly contributed to the rise in homelessness during that period. First, cuts in supplemental security income, also known as SSI, in the late 1980s, accompanied by a tightening of the disability eligibility process in the Social Security Act of 1980, adversely affected mentally ill homelessness for many of those individuals. The subsequent loss of personal income contributed to homelessness for many of those individuals. cited by Collin and Berry in 1987. The Social Security Disability Benefits Reform Act of 1984 was later enacted to pull back on some of the aspects of the 1980 Social Security Act, which impeded the efforts of some individuals experiencing illness and homelessness to pursue benefits. Second, public inebriation was decriminalized in many cities, and those once jailed for public drunkenness now avoided arrest and often entered shelters or remained on the streets. Homelessness and the HIV/AIDS epidemic. Another major factor that increased the numbers of individuals experiencing homelessness during the 1980s was the HIV/AIDS epidemic. Culhane and colleagues in 2001 presented data from the city of Philadelphia indicating that the two conditions, AIDS and homelessness, quote-unquote, frequently co-occur, by Culhane et al., 2001, page 515. Those shelter users who were male, substance abusers, and diagnosed with a serious mental illness often had a co-occurring AIDS diagnosis due to risky behaviors such as sharing needles for intravenous IV drug use. The authors also noted that Philadelphia shelter utilizers had 9 times the risk of having AIDS compared to the general population. LaBelle et al. 1995 noted from their retrospective cohort study comparing housed individuals with AIDS and individuals experiencing homelessness with AIDS in Boston that the unhoused men with AIDS were more likely to be African American or Latino and be IV drug users when compared to the housed men. The authors noted that IV drug use was a common risk behavior for the homeless men when compared to the housed men. Further, quote-unquote, given the increasing number of AIDS cases among IV drug users and people of color in general, it was observed that intravenous drug use may be at least partly responsible for the higher number of AIDS cases in the population of individuals experiencing homelessness. In response to the co-occurrence of AIDS and homelessness, the Office of HIV and AIDS Housing in HUD was created in 1990 to manage the housing opportunities for persons with AIDS, also known as HOPWA, program under the Cranston-Gonzalez National Affordable Housing Act, PL 101-625. The program was created due to inadequate housing resources for low-income people living with AIDS, who also faced difficulty obtaining supportive services and experienced discrimination. HOPWA funds are provided to eligible states and cities based on a formula. There is also a small competitive grant program. The confluence of these and other events changed the face of homelessness yet again. The typical homeless person of the 1980s was younger, less than 40 years old, more impoverished, and had a higher burden of co-occurring mental health, and substance use disorders than previous generations of persons experiencing homelessness. For the first time, women and families appeared in significant numbers. Shelters that had long served poor and older alcoholic men withstood a new and eclectic wave of impoverished men and women displaced from their homes, many of them struggling with undue burdens of co-occurring medical, psychiatric, and substance use disorders. Many others were simply living in poverty. Sociologists refer to this generation as experiencing, quote-unquote, literal homelessness, with no access to conventional dwellings, such as houses, apartments, mobile homes, rooming houses, or SROs. Different types of homelessness. The amount of time that individuals who experience homelessness are without stable housing varies considerably. From short to more extended periods, Kuhn and Culhane, 1998, categorize homelessness with a temporal topography when examining the utilization patterns of single adults in public shelters in New York City and Philadelphia during the 1980s. They identified three groups of individuals experiencing periods of homelessness. One, transient, 80% of those using the shelter who had a single brief stay. Two, episodic, 10% of shelter users who had repeated but brief shelter stays. And three, chronic, 10% of users who essentially spent each night in the shelter. Related studies in NYC found that the small group of chronically homeless adults comprised 18% of shelter use, staying for more than 180 days in their first year in the shelter system and accounting for 53% of the total shelter days used by single adults. Philadelphia data indicated that 10% of single adults staying in shelters accounted for almost 35% of the total shelter days. The identification of specific subgroups of individuals experiencing chronic homelessness shaped later federal policy. Using administrative data regarding shelter utilization from NYC, Philadelphia, Columbus, Ohio, and the state of Massachusetts, developed a typology of families experiencing homelessness. Families who are episodic shelter users were more likely than others to exhibit a behavioral health or social service history. The authors note that the number of families who are episodic shelter users is relatively small. Long-term shelter users among families experiencing homelessness, in contrast to single adult shelter users, were not more likely to have high service needs or barriers to housing ability. The authors argued that a simple policy solution to help families experiencing homelessness would be to provide emergency or transitional rental subsidies. Federal responses to homelessness. Early response. Until the late 19th century, the problem of homelessness was in the hands of local and state authorities. Urban slums in many cities, plagued with overcrowding, poor hygiene, and rudimentary sanitation, became a frequent source of outbreaks of major infectious diseases. To address the growing problem of urban slums, in 1892, Congress allocated $20,000 to the Department of Labor to investigate urban slums in cities with at least 200,000 residents. In 1908, President Theodore Roosevelt formed a formal housing commission to continue these investigations, but these efforts were halted with the stock market crash of 1929. Consequent to the Great Depression of the 1930s, there was a significant increase in the number of persons experiencing homelessness in America and a greater need to address poverty into pieces of legislation that were enacted to improve the overall quantity and affordability of housing. For example, the Emergency Relief and Construction Act of 1932 authorized the Reconstruction Finance Corporation to lend public funds to corporations to build housing for low-income families. Another relevant federal legislative act from this era included the National Industrial Recovery Act of 1933, which allowed the Public Works Administration, a government-sponsored work program, to use federal funds for slum clearance, the construction of low-cost housing, and subsistence homesteads. Close to 40,000 housing units were processed that year. Post-World War II legislation. Decades of economic distress, followed by 5 years of World War II mobilization, resulted in severe housing shortages and led the federal government to lay the cornerstones for today's affordable housing system. For example, in response to the severe housing shortage after the war, Congress passed the Housing Act of 1949. Its goal was to offer a quote-unquote decent home and a suitable living environment for every American family. Unfortunately, the urban renewal programs it authorized often destroyed more housing than was created. Its use of public housing to serve the displaced households, who were generally minorities, and creation of a federal housing administration mortgage program to finance suburban housing available only to whites helped to entrench poverty and segregation in America's cities, particularly for people of color. The Housing Act of 1954 continued and broadened slum clearance and urban redevelopment in inner cities. It was not until the Housing Act of 1956, PL 84-1020, that relocation payments were authorized to those individuals and families who were displaced by the process of urban renewal.